I'm Bill Catterite, President of the National Retiree Legislative Network, here to present this 10-minute video, What Caused the Medicare Financial Crisis? The first and longest in a series of 5 videos about Medicare privatization. NRLN staff and our research partner, the American Retiree Education Foundation, have spent years extracting and analyzing data, much of it from sources shown behind me, and from meetings with Congress and their staffs, as well as other national advocate organizations. Organizations that produce reports that are primary in this study are the Medicare Trustees Annual Report, assigned by the Secretary-Treasurers of the Treasury, HHS, and other key officials. Medicare Payment Advisory Commission is the MedPAC, which is the Congress's watchdog. HHS is the organization that supervises the Center for Medicare Services, CMS, that runs Medicare. The CBO, the Congressional Budget Office reports, and other papers from the New England Journal of Medicine, Kaiser Foundation, and other nonpartisan sources. We always strive to be factual and remain nonpartisan. The NRLN supports private insurance competition for Medicare insurance business, but only the American way, without public tax dollars being used to subsidize insurer overhead and profit, where Medicare is allowed to implement across-the-board competitive bidding, specification and formulations development, quality and service requirements, requesting and evaluating bids, negotiating to select suppliers without political interference. Those things are all important. Congress and the executive branch are drinking industry Kool-Aid and have adopted the U.S. prescription drug industry and Chinese business models, not the American business model. We say no more 50% rebates to suppliers who deliver 1 star out of 5 quality ratings, or 5% bonuses plus 70% rebates for 4-star and higher ratings. In America, we don't do business with 1-star performers. Instead of handing money for 5-star performances, we ask for lower prices and award plaques and hang medals around the necks of supplier executives at quality banquets. After years of insurers taking over $300 billion in taxpayer subsidies, Medicare Advantage plans have not shown they can be competitive with original Medicare A and B fee-for-service without government subsidies. In 2020, billions of dollars in subsidies were approved to pay for new chronic benefits, falsified TV ads, and robocalls, like those that always interrupt our dinner hour. These new benefits apply to Medicare Advantage plans that cover up to 20 million enrollees but are denied to 40 million in original Medicare, who may need the same benefit to stay alive. This is plain and simple perverted logic, maybe fraud. It's a scheme to induce privatization and violates a 2016 presidential promise. There is a coming Medicare financial crisis, but the reaction from Congress has been the ultra-conservatives want to destroy what they declare to be welfare and call for benefit cuts, eligibility changes, and privatization, while the ultra-liberals argue everyone should be entitled to all they want, thereby digging the hole deeper. Predictably, Republicans and Democrats in Congress have locked arms to privatize Medicare in order to avoid being held accountable. Instead, they dole out our tax dollars to finance healthcare insurer profits. Now, the NRLN's #1 goal here is to protect retirees who've already bought a Medicare Advantage plan, HMO and local PPO plans. They're from being victimized by new and increased premiums, deductibles, copays, and coinsurance that are inevitable. Now let's dig into some facts. Congress and the CMS would have us believe baby boomers are our biggest problem. That's only partially true. This U.S. Census data table that we have shows that the chart behind me tells you also that the census projects that by 2030, 65 million baby boomers will be over age 65, up 40 million from 2015. But then it drops from 65 to 44 million by 2040, then to 3 million by 2060. In contrast, those over age 65 grow from 48 million to 74 million from 2015 to 2030. Then to 82 million by 2040, and to nearly 100 million by 2060, when 25% of the 2060 total U.S. population will be over age 65. Forget the details, just remember we are an unprepared aging nation. Congress chose to use general revenue tax dollars to slyly pay for growing healthcare costs over time, and rather than disclose their support for competitive bidding or other cost reduction programs. Cutting or delaying benefits now would create a lost generation before 2060. Think of your children, your grandchildren, and your great-grandchildren. One with little purchasing power, but adding benefits would dig an even deeper hole. The table behind me was extracted from the 2019 Medicare Trustees Report, and the red figures tell us that Medicare expenditures were $741 billion in 2018, but they explode to $1.6 trillion by 2028, an alarming 114% increase. Over the same period, enrollees grow only by 28%, up to 76.7 million. Therefore, expenditures rise 4 times faster than the growth of enrollees. So is it the baby boomers? No, they go away. And Congress has known that for a long time, for 40 years, that the 100 million were going to be out there in 2060. Past and current Congresses and administrations have done little to prepare us for economic shock of our century. Now we face an out-of-control healthcare cost problem. The best way to measure effective Medicare healthcare and cost management is to compare CMS expenditures per enrollee over time. The last 2 rows of this table show that from 2018 to 2028, Medicare A, B, and D combined expenditures are projected to grow 67%. A and B combined, the current Medicare plan, grow 68%. But private plans, Medicare Advantage plan, enrollee expenditures per enrollee grow 75%. These data project that A and B combined expenditures per enrollee will grow from $946 to $1,594 a month. That's a whopping $1,648 a month increase over 9 years from now. $648. The critical question is, can a privatization model reduce Medicare expenditures per enrollee better than the fee-for-service model? If not, we have to dump rebates, cost reduce and competitively bid everything through the fee-for-service structure, incorporating new approaches from within. Eliminate the $90 billion CMS overpayments. Just do it. In videos 2 and 3, we'll show you eye-opening facts that will reinforce and support the need for our challenging privatization. Facebook and YouTube viewers who want to see these past or future videos need to sign up, www.nrln.org, to get advance notices of video postings. Our secure website is the least expensive way to reach you. Use our website call-in number and email address to ask questions or offer suggestions. I'm going to see you real soon with more details in about a week. I think you'll enjoy it and you'll appreciate what we're doing. Thank you very much for your time.